Hi, everyone. My name is Ashley Swain, and I am on the Partner Strategy team here at Tableau. We're so glad that you can join us today to hear how Boston Children's Hospital, one of our customers, has worked with AtScale and Tableau to make the right public health decisions to keep the most vulnerable members of our population, our children, safe during COVID. We know that everyone is looking for new solutions for moving your business forward. And AtScale's Olap data model is a great way to join COVID data with the data that you're already using to run your business. So what you're going to see today is COVID Near You, which BCH has built out. We have a great map that allows us as community members to see where COVID is so that we can keep ourselves safe. Before we get started, a little bit of housekeeping. We want to hear from you. We have Q&A at the end, but we would love for you to submit your questions. When you have them, into the Q&A box. It's in the lower left of your screen. Whatever you think is important, you'd like to know, please submit it. We're looking forward to connecting with you and talking with you. We're going to start off today with BCH. They're going to show you what they've built and why it's critically important to keeping our communities safe. Then AtScale is going to talk about their Olap data model and how they enabled COVID Near You and how they can enable you to succeed with COVID data and your organizational data that you're already using. And BCH is going to show you in Tableau how they have used analytics to enable the right decisions. We're joined here today by Kara Seawalk from BCH, Ben Rader, also from BCH, and Dr. Christina Ashley, who is at BCH and also in the faculty at Harvard Medical School. Daniel Gray is joining us from AtScale. He's the VP of Solutions Engineering, and he has an excellent demo for you that shows you exactly how the COVID data model enables insights in Tableau. With that, I'm going to hand it over to Kara.
Thank you, and I appreciate the introduction as well. So as a program manager at Boston Children's Hospital, I'm here to tell you a little bit about COVID Near You and the background of our project. So COVID Near You was created in March 2020, about 2 months ago, in response to the ongoing COVID-19 pandemic. For background, our research lab is based at Boston Children's Hospital and has a focus in innovative disease surveillance. Our group has a range of expertise from epidemiologists to software developers, researchers, data scientists, program managers, and clinicians. In 2012, our team launched Flu Near You, flunearyou.org, a crowdsourced participatory surveillance system which allows the general public to report symptoms and health behaviors related to flu, aimed to enhance community influenza surveillance. And using this self-reported data, we explore flu patterns in our seasonal research, and we partner with federal and state and local health agencies to augment traditional tracking of flu in real time, capturing a population that may not be seeking healthcare. So with this background in crowdsourced disease surveillance, we know how valuable self-reported data can be. Since COVID-19 began to circulate within the United States back in January, February, there has been a lack of access to testing for this disease, coupled with an ever-expanding associated symptom list. And everyone in the field of public health and medicine is challenged with understanding the dynamics of this emerging disease. So in March of this year, our group teamed up with volunteers across the technology sector to augment that Flu Near You model and create COVID Near You to supplement disease tracking of COVID-19 throughout the pandemic, using those self-reported data from the general public. Using this approach, we aim to better understand the true burden of disease and identify current and future hotspots of COVID-19 activity. So here you can see on this slide the homepage of our website, covidnearyou.org, and a mapping of reports from our website to showcase users a mapping of activity in their area reported to our website. You can also search by zip code on the website to see a more granular view of your area. On this slide, you can see the detailed view of the surveys that we're asking and a selection of questions that are short and simple surveying. So with that brief background, I'll hand it over to Daniel from AtScale to take it from here.
Thank you, Kara. All right, thank you everybody for joining today. So what we're going to basically cover, as far as the demonstration here in the next couple of slides is, an Olap model that's been applied to the cloud. And so what we've basically done is we've worked really closely with Boston Children's and the COVID Near You team, and we've built out an Olap multidimensional model. So that's measures, dimensions, and hierarchies that you can quickly do analysis on top of the data sets that they have collected. And we're going to walk through how we did that and how we simplify the consumption of that data for Tableau users. One thing I'll just mention is that this is a super interesting data set. If you look out there, there's a bunch of different data sets that you can take a look at. There's a Johns Hopkins data set, there's a WHO data set, and you can derive some interesting insights. You can look at how things are happening over geographies and time, but it's pretty high level information. So, are you sick? Do you have negative? Do you have positive mortality rates and things like that? The great thing about this data is that it is really granular, it's really fine, and it provides a lot of really great insights. So you can find out, did someone have a particular temperature in a particular zip code? Did they have a rash? Did they have a stomach ache? You can start to combine all these different things. You can drill down by different topics. You can look at a lot of different information. And what we wanted to do is take that and make it very easy to consume within Tableau with no data engineering required and no modeling. And so that's what we're going to be walking through today. So just jump into the next slide here. I'll just say a few words about AtScale. Essentially we provide the ability to define a multi-dimensional model on top of your data platform. So you can really think of us as an abstraction between Tableau and your back-end data platforms. One of the key capabilities that we have is as Tableau users, as different users come in and actually use this data, we're actually going to automatically do all the data engineering on the back end of the system to ensure you get the best possible performance. That's important because when you're doing this what-if analysis, you need to be able to move quick. You shouldn't have to get up and go get a coffee and come back and wait for an answer or come back the next day because you've lost train of thought, you context switch, and you're going to lose time. With AtScale's autonomous data engineering, we're building out the data structures to get the best possible performance. So when you're doing your what-if analysis, you're going to get back your next response, you're going to get back your next answer, and you're going to be able to go on to the next insight. Essentially what that does, it also eliminates the need to do any manual engineering on the back end of the system. In addition to that, AtScale provides a universal semantic model. So you'll see that here in a second. We're going to pop it up here on in part of the live demo. And what that is that it gives you the ability to take things like facts and dimensions and denormalized data, star schemas, and turn those things into quantitative values, so measures and things like that, and into dimensional constructs, so your who's, what's, when's, and how's, and hierarchies. And by doing that all in one place, whenever you have Tableau users coming in and defining new dashboards, you have one single place where you can define all that, all those business constructs, and you get governance around that. So it's a single universal semantic layer, and you'll see that firsthand here in the demonstration. And ultimately, what that allows you to do, if you put those two things together, is provide an abstraction between your Tableau users and your back-end data platform. It allows you to control a lot of complexity. It drives down costs because you're always hitting, performance structures versus raw data. And ultimately, it mitigates risk. So a really great example of that is throughout the pandemic, the COVID-like illness description has changed quite a few different times. And we've actually worked closely with the Boston Children's team to actually make those changes within the model so that you can, one, see the evolution of that, but two, provide governance around that. So one, if you have a bunch of different dashboards already defined, you can make that change really easily within a semantic model and then push those out to the dashboards. And two, it gives you governance around that so that you ensure that everybody's using the same type of definition. All right, so just quickly, I'll just spend just 1 second here and then I'll get into the demonstration. Effectively what AtScale is an abstraction between your backend data platforms and Tableau, the Tableau processes. What AtScale allows you to do is basically pull in complex data structures from your different data platforms into a single semantic model. So you may have some data sitting in one data platform, another data sitting in another data platform. You can bring that all within a single model, and then you can define out your measures and your quantitative values. All right, so with that, let me actually just start to share here, and we'll get into to the demonstration. So I'm going to share my screen. All right. All right, so let me say a couple words first about the data. And so when we started working with Boston Children's and the COVID near you team, we took a look at the data, and the data structures were actually in a document store. And so it was a single, you could think of it as a single kind of collection of data, a bunch of key value pairs, and that's it's a place where you can store data, and you can start to do some analysis by pulling that data out and doing that analysis in different tools. But effectively, what we wanted to do was take that data and turn it into dimensions. So your who's, your what's, your when's, and your how's, so your intersections, and hierarchies. So you can do drill down analysis across geos, across time, across different symptoms and things like that. And then we wanted the ability to basically make it really easily consumable by a tool like Tableau. So if you log in with Tableau, you don't need to do any data modeling. All you have to do is log in. You're going to see all your measures. You're going to see all your dimensions. You're going to be able to immediately start slicing and dicing, and there's no data modeling required. And there's no data engineering required either. So you don't need to worry about ETL processes. You don't need to worry about writing complex SQL. And you don't need to worry about building out any type of performant aggregates, because we're going to do all that for you automatically. So what you're looking at here is the AtScale portal, and this is the basic, COVID near you model that we built. What you can see here is basically this user submission object here in front of us is the single document collection store that we took out and started modeling, and we built out a bunch of dimensionality. So we've added a geography dimension so that you can actually do drill down analysis. So you can see basically drill down analysis. So within that data set, there's only a zip code today. So we're able to easily model out a geography dimension. And so now we have the ability to do drill down analysis by country, by state, by county, by community. We've also added security dimensions. And so different users of this particular model come in, and if they're permised to actually see aspects or different zip codes, then we'll actually enforce those within the universal semantic model. And then, same thing with the time hierarchy. So we were able to define a time hierarchy here, and that gives you the ability to do drill down analysis. We're doing all the sanity checks to make sure that the cardinalities are good and you're getting the right values back within the AtScale product. And we ultimately built out a dimensional model off a single object. And so no ETL was required. And you can look here. So this is like the key value pairs that were coming from. Okay, I just got a text. Are you able to see, are we able to see the AtScale model right now? Let's make sure.
Yep, looks good, okay. Daniel.
Excellent, okay, all right, thanks. All right, so basically you can take you can take what's in that collection and you can immediately model it out. So if you take a look at these different values here, so these are all key value pair Boolean values. While you can do analysis of that in different tools, you're gonna have to write quite a bit of complex SQL to make that happen. We're able to take this single object and turn it into a multi-dimensional model. There's no ETL. These are not actual physical tables. We didn't have to write any ETL code. We did it all right here within AtScale. And then we easily published this model. And what it looks like to Tableau is basically what we discussed a couple minutes ago is our dimensions. So your who's, your what's, your when's, and your how's, and your measures, so your quantitative values. None of this complexity really matters. All you're going to see is as you consume this model are your dimensions and your measures. And so what we're doing with the Boston Children's team is that we're starting to add a whole nother set of data categories. So we're adding transportation data, we're adding Google mobility data, we're adding these different data structures to the end user. So anybody that's coming in from Tableau, there's no complexity there. All you have to do is log in, you're going to see these new measures, you're going to see these new dimensions directly within Tableau. So let's go ahead and just jump to Tableau real quick. And what I'll do is I'll just quickly show Tableau and our semantic model, and then I'm going to turn it over to Christina with Boston Children's to kind of talk through some of the findings that they've started to develop. So real quickly, I've popped open Tableau here, and I won't get into the visualizations yet. It's still Christina's thunder. But the important thing from the perspective of the semantic model is if you look on the left-hand side, you basically see your different measures. So these are your quantitative values, and you see your different dimensions, your who's, your what's, your when's, and your how's. And you're able to start slicing and dicing immediately. You never need to go into data source and do any modeling. You never need to write any complex SQL. You don't need to worry about going from a document store to some type of relational model. We've taken care of all that work for you. So let me do this. Let me bring in Katrina, and then we'll start to walk through some of the visualizations that we've built over the last few days.
Hi, can you guys hear me okay?
Yep.
Great. Okay, so yeah, Daniel and I have been working to create some visualizations to highlight some of the great tools that you can access through this. So for the first visualization that he's showing, what we wanted to highlight is that you can take a case definition. In our data set, for this first visualization, we're just showing that initial WHO CLI definition, which was fever with respiratory symptoms, including cough or shortness of breath. And here we can show you how you can easily create a map of the United States with CLI percentage by each state. The data are more granular than this, and you can break it down by county and by zip code easily within the Tableau visualizations of the AtScale semantics. So then this is an example of a map when we first launched COVID Near You, which is the 23rd of March through the 5th of April. But we're going to fast forward now and move to the most recent 2 weeks that we have data uploaded into the platform, and to show you how things have changed over time as social distancing measures have come into play. So what you can see now is that you can not only make a map, but you can make the map and follow the map over time. And as you can see, CLI, based on that strict definition of fever plus cough or shortness of breath, has declined dramatically over this period of time. But now, as Daniel had mentioned, the definitions of CLI, COVID-like illness, have evolved over time as we've appreciated more and more about the biology, physiology of COVID. And so recently, other case definitions have been proposed for syndromic surveillance, and we're going to transition from this strict definition to a much broader definition proposed by the CDC, which is one major symptom or two minor symptoms. So for example, you don't need fever plus cough. Cough alone would be sufficient. And what you can see here is that we can replot the same graph using the new CDC definition, much broader, and now actually see that there's more hotspots than we had seen before. Now, Daniel's going to move to show you all four of these maps together, so two different time points with two different CLI definitions, just to kind of highlight how you can visualize these data with Tableau, harnessing the semantics from AtScale. So as new definitions of for syndromic surveillance evolve, you can create new definitions and apply them across all of your visualizations. The COVID Near You data is actually much richer than this. We're just highlighting one key aspect, which is that there's lots of different symptoms that we've asked about. You can combine them in different ways to make different visualizations. But now Daniel is going to move to another visualization just to highlight some other aspects of the data that we have. For example, we have asked individuals whether they have sought medical care, whether they've received COVID testing, and what their test results are. So this is just an example of how you can look at access to healthcare and access to testing over time. So on the horizontal axis, we've binned by 2-week bins, starting from when COVID Near You launched up until most recent. And then on the vertical axis, the proportion of people who met this broader definition of CLI, who sought medical care and also received a COVID test. And as you can see, generally across all of the states that we've plotted here in the box and whisker plots, access to testing seems to be increasing over time. And this is the kind of information that we're using in discussion with public health groups to help better understand not only the incidence of COVID-like illness across geography and across time, but also how individuals with COVID-like illness are accessing medical care and testing. And we have lots of different dimensions here, not just access to any medical care, but urgent care visits, virtual visits, hospitalization, emergency visits, and so forth. So with that, in the interest of time, I believe we wanted to leave a few minutes open for questions and discussion. And I'll pass the baton back to the Tableau and AtScale group.
Christina, thanks so much. Daniel, thank you. So we do have a few questions, and we have a great one from Apurva, and the question is really for AtScale. Do you all offer this data for machine learning models that your customers may have built in-house? And I think it may be a bigger question for AtScale around how do customers engage with you and their own data?
Yeah, that's a great question. And so, you know, there's a lot of different components to machine learning, and those components require different levels of granularity. So where we see our customers working closely with us around machine learning is really in two areas. One is around feature engineering. So if you think about feature engineering, typically it's a lot of what-if analysis, and so you're looking at different quantitative values, and you're looking at cross sections of those values. Within AtScale, because we're providing you a governed model around those quantitative values, and then we're doing all the data engineering to ensure you get performance, it allows you to do very fast feature engineering within AtScale. Another place that we help our customers with machine learning is that as you are learning things from your models, those will be pushed back into a particular data platform, and then we will turn around, build those back into the model. So we have a feedback loop there, and then you can build those back into your Tableau dashboards so that you're learning from you basically have a full feedback loop from your modeling directly back into your data platforms.
Thank you. A couple more questions. Here's a good one. What are the most common challenges at scale that you are seeing with integrating COVID data and more governed organizational data sources?
Yeah, that's a really great question, because as you look at this data, you know, if you're not careful about how you analyze the data and how you do your data engineering, you will absolutely get the wrong values back. So you have to be really careful. You know, I'll give you a couple examples. A lot of the data that's out there is accumulative in nature. And so you can't just go out and do a SQL query and say, give me all cases in Texas for the month of May and just sum that value up, because you'll actually get the wrong value back. And you can't just join things, because then you have to be really careful about what type of join you do, because then if you get an unrelated dimension, you get the wrong values back. So you have to be really cognizant of what you're doing in the data. And if you're a really great data engineer and you have a lot of really great SQL experience, you can work through those issues. But a lot of folks are analysts. They want to focus, they want to use a tool like Tableau, and they want to be able to do their analysis without necessarily needing to write or be concerned about those issues. And so what we're doing with our customers, and in this particular case, is through our semantic model, we can actually eliminate that complexity. So we'll take care of handling like the cumulative data that I told you about. That's a semi-additive measure. So we can define those within our model, and then you don't have to write that complex SQL. You can define all your quantitative values directly in one single place, so that as different people are doing different type of analysis, they're all getting back the same results. And so that's some of the complexity that we've seen with the data out there. And as you start to add your own data in, so your business data in, it may not be relatable. And so with AtScale, you can start to solve some of those problems by building relatable type of dimensions between your different data aspects. And so that's certainly something that we've seen out there. And a big part of the push on why we've been providing models around COVID and around COVID near you is we want to be able to eliminate those complexities and just provide a consumable model to anybody that has access to Tableau.
Yeah, that's fantastic, Daniel. I see you sharing your screen. Was there a demo that you wanted to show us as well, or a product feature?
Yeah, I'm sorry. Yeah, I was just gonna.
Oh, there you go.
Yeah,
Great.
I was just gonna pull up, an example of, so as we're, kind of the complexity here is as you bring more and more pieces of data into a model, the more it gets complex, the more complex SQL you have to write. And within AtScale, we kind of simplify that with a nice drag and drop interface, and we take away a lot of those complexities. And so, as you add something new, so maybe tomorrow you want to add an economic indicator of some sort because you want to understand, hey, when is the best time for me to start my business again in a particular geometry, in a geo, then you can start to easily add that and take that complexity out within your model.
Yeah, that's great. Well, we have another question about, the responsiveness of your model from Anki. How was the change in the CLI definition, which is what Christina started off talking about, handled? Was it handled within AtScale or was it in Tableau? And, this is a really great question because most of us are working with really well-governed data sources that aren't necessarily designed to respond well to change or even to anticipate it.
Yeah, that is a great question. And so within what you saw here and what you've seen within this model is you're doing that directly within the AtScale model. So that's where you define that quantitative value. That's where you define that logic around what is a COVID-like illness. And by defining it in one single place in the AtScale's universal semantic model and republishing our model, which takes about a second to do, you're able to basically refresh your data source in Tableau, and you immediately pick up that change. And as far as performance goes, we're automatically going to start building out what we call acceleration structures, or you can think of them as intelligent aggregates, to ensure that you get the best possible performance as you're drilling down within your different aggregates. The last thing I'd say about that is if you think about Olap, traditional Olap, you build and you materialize a cube. AtScale does not materialize a cube. So if you make a change to COVID-like illness, you don't have to go through and rebuild a cube, pull all your data off your back-end platform, materialize that cube. We're virtual in nature. And so you can make a change very quickly, republish a model within a second, refresh your data source in Tableau, and those new values will immediately start coming through.
Yeah, you made a really good point there, Daniel, about the changes going directly from the AtScale data into Tableau. In Tableau, if you have a live data connection, Anki, the changes to the CLI definition will appear automatically. So nothing extra that you need to do unless you're extracting your data, which a lot of people do for performance and security reasons. Other questions for AtScale and or Boston Children's Hospital? No? We would love for you all to connect with BCH and with AtScale. COVIDnearyou.org is a great place to find out what COVID is like near you and to self-report. Something we haven't mentioned, COVID data is self-reported. I myself have participated in some studies. We have other partners who are offering them for different reasons. Please visit COVID Near You, self-report, engage with it, make it a habit as we evolve through the pandemic, and then also connect with AtScale. AtScale.com/COVIDnearyou. We will send out a follow-up email within the next 48 hours that includes a link to this webinar on demand. Please connect with AtScale, please connect with BCH, and please engage and self-report your information so that we all can stay well together. Thank you very much.